Hello everyone, and welcome to this audio podcast. This audio podcast as part of the Hilium Space Edition or series. This audio podcast as part of a calibrated morphology, and this audio podcast as part of a Storm Robotics production. So in this audio podcast, sort of following on from sort of looking into some of the causes around hematuria. This audio podcast will go into sort of look into around this significant hematuria. So hematuria is mostly is most usefully divided into, again, sort of one visible, which is macroscopic hematuria, um, hematuria, and two non-visible microscopic hematuria. These can be subdivided. These can be sort of further sort of subdivided as a symptomatic, again, SNVH, associated with lower urinary tract symptoms, frequency, pain on voiding, loin pain, and suprapubic pain, and B, sort of asymptomatic, which is a non-visible hematuria, or ANVH. And persistent ANVH is defined as having a greater than one positive result on a urinary dipstick test, and some persistence is thus defined as having two out of three urinary dipstick tests positive for non-visible hematuria, or NVH. And when there is a need to differentiate, and when there is a need to whether so when there is a sort of a requirement to differentiate persistent invisible sort of hematuria in the absence of proteinuria, from transient hematuria. Two out of three positive reagent strip tests, or urinary strip dipsticks, or urinary dipstick, or urinary strip tests. Urinary strip tests are regarded as confirmation of persistent invisible hematuria. A trace of blood on a urinary dipstick test is not often is not regarded, as initially significant, as initially sort of significant. Urinary microscopy is not urine sorry urine microscopy Urinary microscopy is not visible sorry urine microscopy is not reliable in detecting non-visible hematuria. So it's not necessary to confirm non-visible hematuria in the laboratory, at laboratory on laboratory findings, as part of laboratory findings. Uh, and Different laboratories, varying laboratories will have different, again, sort of different laboratory sort of reference ranges, investigations for sort of hematuria. And so initially, again, urinary microscopy is not reliable in detecting non-visible hematuria, because generally speaking, or generally from laboratory investigations, non-visible, where the reference range for hematuria will tend to indicate and will generally indicate that a recipient or patients where non-visible hematuria is evident, it's not significant enough to actually cause sort of tract sort of abnormalities. For example, And so non-visible on its own, non-visible hematuria on its own is not sort of for example on its own sort of serious enough for laboratory specialists to inform sort of clinical teams that hematuria is and potentially can be or might be persistent as part of the patient's or recipient's etiology around whether it's around, for example, a urological basis or a nephrological basis. So that draws this audio podcast to a close. This audio podcast has been part of as part of a Hilium Space Edition or series. It's been an audio podcast as part of a calibrated morphology, an audio podcast as part of a Storm Robotics production.